Hi, Dr. Kevin Zorn from BPH Canada, here to show you the very small finesse instrument that we use here for aquablation. So as you may know, we have a new technology using high pressure water, no heat, to ablate tissue using a robot. So this small instrument is placed through the urethra. It can treat up to 7-centimetre lengths of prostate in one pass. So occasionally we may have to do 2, 3, or 4 passes. Each treatment is 5 minutes, and we're using very high pressure water passing through this small sapphire crystal opening at 8 to 9,000 psi. So it can treat up to almost 2.5 centimeter radius distances of the tissue that we pre-program. We use an ultrasound, all real-time watching, seeing how the tissues ablate and making small changes. And once that's complete, then we have this huge 5-centimeter opening in the center of the prostate, to which we'll use a small ejaculatory loop to just fulgurate small areas of bleeding. And we're one of the first in the world actually to do this as outpatient surgery here, part of BPH Canada. So again, one of the advantages, very low incontinence rates, less than 0.5%. Very different than we see with laser or nucleation. So when you have a hole-up or thule-up, part of it, the recovery is some people call transient incontinence, where patients are having to do physio, Kegel exercises. We don't have to deal with that with aquablation. There's no movement to this instrument. So unlike the torque motions that we would do in some laser techniques, the sphincter doesn't get stretched or injured. We also protect a rim of tissue just around the edge of the end of the prostate to protect ejaculation. Again, compared to any other resective techniques, TURP, laser, hole-up, aquablation is the only one that preserves to almost 85-90% success rates ejaculation. So if that's important to you in your future, you should be learning more about aquablation. So again, a unique robotic assisted treatment done usually in about an hour and 15 minutes under an anesthesia here in the operating room, to which we'll keep a catheter usually for 2 or 3 days and then have that removed. The recovery is a lot faster too, since you're not using heat. There's no burning of the tissues. Kind of the analogy I explain to patients, it's like a paper cut. At some point you've gotten a paper cut, it heals quite quickly. Versus a burn, if you burn yourself with any kind of thermal knife, a heating instrument, or on the oven, it takes a lot longer, as your immune system has to get rid of all that dead tissue and then it can heal. So with aquablation, very little necrotic tissue for your body to have to remove, so it epithelializes faster. So that's it. Here's the instrument in close. Very unique, extraordinary, and really life-changing to many men, and I think revolutionizing the way we treat BPH. Personalized medicine, real-time imaging, robotic executed, and all the preservations, things that most men don't want to have or are scared of to undergo surgery, is the incontinence and the loss of sexual functions. With aquablation, we can preserve that. So to learn more, come visit us at BPH Canada or give us a call, 514-443-0808 to learn more. We look forward to taking care of you.